In today's video we are going to give you a useful guide of 15 ways to combat psychomotor impairment and depression. Before moving on, what is psychomotor and psychomotor impairment? Psychomotor refers to the connections made between mental and muscle functions. And psychomotor impairment occurs when there's a disruption with these connections. Now, how does it affect us? It affects the way you move, talk, and other regular activities. Studies show that impairment can be prevalent in adults and teenagers as well. There are 15 ways to manage impairment and associated depression. Point number 1. Identify triggering source. Listen to your mind and body. A simple step that you can take is to pay attention when any triggering situation is prevailing. Notice small changes that are altering the functionality of the mind and body. Be optimistic and look for possible solutions and treatments to manage impairment and depression. Point number 2. Demonstrating skills to improve. Demonstration of skills improves the psychomotor development by breaking down steps into subunits and do practice before proceeding into the next subunits. It helps a lot to overcome psychomotor impairment and reduce depression or anxiety. Point number 3. Practice physical performance. Distributed practice is more effective in the development of psychomotor skills than massed practice. Doing frequent practice sessions over a long time are most effective. Limb practice helps in managing psychomotor impairment in teenagers and adults. Point number 4. Enhancing mental functions. If you cannot throw a ball, then there is a need to focus on that specific muscle in carrying and throwing. You are instructed to think and imagine a ball and steps that are required to complete a task. You can feel the movement by thinking about it. It also enhances mental functioning and mental muscle coordination for managing psychomotor impairment. Point number 5. Provide motivation. Without motivation, you can't achieve anything. It can crush you, literally cripple you from taking action. Keep repeating in your mind, you can do it. It helps in overcoming psychomotor impairment and associated depression. Point number 6. Make cognitive goals. You need to look for psychomotor issue and muscle that is not responding. After diagnosis, you are required to set cognitive goals. Professionals explain the skill that needs to be focused on you. Create a scenario, and skills are taught to the one who is suffering from impairment. Point number 7. Affective goals. The affective goals in the treatment of psychomotor impairment involve acknowledging the need to teach the mechanics of skill before applying higher-level thinking, valuing the need for others to practice until they attain mastery level, and modeling excellence in skill performance. Point number 8. Articulation. Articulation is important to produce sounds, words, and sentences that are clear and can be easily understood and interpreted by others. It can enable the person to be able to express basic needs and engage in complex conversations. It helps in managing impairment to treat psychomotor impairment issues. Point number 9. Provide feedbacks. The purpose of providing feedback is to improve the situation or the person's performance. You won't accomplish that by being harsh, critical, or offensive. You'll likely get much more from people when your approach is positive and focused on improvement. Point number 10. Anti-psychotic. If psychomotor impairment is related to manic or depressive episodes, your doctor may prescribe mood stabilizers or antipsychotic drugs. A 2013 study found that the anti-anxiety drug benzodiazepine can help treat types of psychosis-induced impairment. Point number 11. Antidepressants. Psychomotor retardation is most commonly seen in people with major depression and the depressed phase of bipolar disorder. Types of antidepressants or SSRIs include fluoxetine, paroxetine, sertraline, citalopram, and Lexapro. Point number 12. Physical therapy to treat psychomotor impairment. Physical therapists are movement experts who improve quality of life through prescribed exercise and hands-on care for patients. Physical therapy is going along with medication and other safety measures to deal with psychomotor impairment. Point number 13. Occupational therapy. Occupational therapists help with barriers that affect a person's emotional, social, and physical needs. A few of the occupational therapist functions are helping with self-care routines like getting dressed, writing and copying notes, holding and controlling a pencil, using scissors. Point number 14. Speech therapy. Speech therapy exercises for adults can help you with speech, language, and cognitive communication. Therapy may also include retraining of swallowing function if an injury or medical condition, such as Parkinson's disease or oral cancer, has caused swallowing difficulties. Point number 15. Electroconvulsive therapy. Electroconvulsive therapy, ECT, is most commonly used in patients with severe major depression or bipolar disorder and leads to psychomotor impairment. If the person has not received any benefit from other treatments, then this technique will be helpful. Do share your suggestions and recommendations. They mean a lot to us. That's all, folks. Stay happy. Stay beautiful.